Welcome to UMCC Medical Consultant Connectors, where your health matters to us. Kindly like, subscribe, and share for more. Meet Maria, a vibrant 78-year-old who loved gardening and walking her dog. One rainy morning, she slipped on wet leaves outside her door and couldn't get up. Her hip and groin throbbed with pain. Her neighbor called an ambulance, and in the ER, we saw her leg was shorter and rotated outward, a classic sign of a pelvic fracture. The pelvis is a strong ring of bones at the base of the spine, protecting vital organs. In younger people, breaking it usually takes a major accident, but in older adults with osteoporosis, even a simple fall can cause serious injury. Our first step: check vital signs. Pelvic fractures can cause hidden, life-threatening bleeding. Gentle examination revealed severe pain and instability. Maria's low-energy fall suggested a stable fracture, common in the elderly. High-energy trauma, like a car crash, can shatter the pelvis in multiple places, much more dangerous. Understanding the injury's cause helps us predict the fracture type and guides our treatment plan. For Maria, the details pointed to a less complex but still serious injury. Quick action and careful assessment are critical from the moment a patient arrives. Recognizing these patterns saves lives. Every detail matters in the first moments. Maria's story is one we see all too often. Pelvic fractures are classified as stable or unstable. This distinction shapes everything. A stable fracture means the pelvic ring is cracked but mostly intact, like a mug with a hairline crack. These usually result from low-energy falls and can often heal without surgery. Unstable fractures involve multiple breaks, making the pelvis unable to support weight, like a shattered mug. These are usually from high-impact trauma and can cause massive bleeding and organ damage. Maria's low-energy fall likely caused a stable fracture, while a construction worker falling from a height might suffer an unstable, life-threatening injury. The pelvic ring's integrity is crucial for movement and stability. Stable fractures disrupt function but don't destroy it. Unstable ones break the loop entirely. Recognizing the difference is the first step in managing pelvic injuries. It determines urgency, treatment, and prognosis. Every case starts with this critical question: how do we spot a pelvic fracture? It starts with pain, intense, deep, and worsened by movement. Inability to stand or bear weight is a major red flag. Swelling, bruising, leg length differences, and abnormal rotation are visual clues. We examine gently to avoid worsening the injury. X-rays are the first imaging step, revealing obvious breaks and helping us judge stability. For more detail, especially in complex cases, a CT scan gives a precise map of the fracture and any hidden injuries. Maria's X-ray showed a stable pubic rami fracture. Imaging guides our next steps and ensures nothing is missed. Accurate diagnosis is the foundation of effective care. Treatment depends on stability. Stable fractures like Maria's are managed conservatively. Pain control, rest, and gradual return to activity with physical therapy. Early movement prevents complications like muscle loss and blood clots. Physical therapists teach safe mobility and help restore strength. Unstable fractures are emergencies. Surgery is needed to realign and stabilize the bones. Surgeons use metal plates and screws to hold the pelvis together. In severe trauma, temporary stabilizers like pelvic binders or external frames may be used before surgery. The goal: restore function and prevent life-threatening complications. Every treatment plan is tailored to the injury's severity. Recovery starts with the right approach from day one. Pelvic fractures can lead to serious complications, especially unstable ones. The biggest threat is internal bleeding, which can quickly become life-threatening. Nearby organs, bladder, urethra, intestines, and nerves are at risk of injury. Long-term issues include chronic pain, arthritis, and mobility problems. Rehabilitation is key to regaining function and quality of life. Prevention matters most. For older adults, fall-proof the home, exercise for bone strength, and manage osteoporosis. For everyone, use seatbelts, safety gear, and avoid risky behavior. A little caution can prevent devastating injuries. Recovery is possible, but prevention is always better. Maria's story is a reminder. Small accidents can have big consequences. Stay safe, stay strong. UMCC, your ultimate medical consultant connectors.